Welcome to Sexuality Education Shorts, Anatomy and Body Awareness for Parents and Caregivers, presented by Advocacy Denver. Anatomy and body awareness is, in short, about knowing the right names for the right parts. It's teaching kids and youth with disabilities the medically accurate terms for their private and sexual parts. We hope to give you a few tools to feel more confident having these conversations at home, and want to remind parents and caregivers that you are your kids' first and strongest teacher when it comes to understanding their body and themselves. You can be a powerful and effective advocate and help your child become a powerful and effective self-advocate throughout life. In the next few minutes, we will cover when and how to talk to kids about anatomy, how to accommodate unique learning styles, and why body awareness is so important for kids with disabilities and everyone. So how early should we start teaching kids accurate anatomy? The answer is it's never too early. As soon as a child is learning about head, shoulders, knees, and toes, they should also learn about all the parts in between. It's a good reminder for everyone that body parts like anus, vulva, scrotum, or breasts are just that. Body parts are not bad words or something shameful. Some families may use nicknames to talk about sexual parts, but it's important for kids to know what those nicknames really mean and when it's appropriate to use them or not. Be mindful of nicknames further promoting shame or embarrassment around body parts, or when they may cause confusion at places like the doctor's office. Don't forget that as we learn about our bodies, we also need to learn how to care for them. Learning hygiene skills early on is vital to healthy development and continued health as adults. Every child has the right to information about their bodies and sexual parts, but how that information is given can vary. We know every child learns differently and are glad there are so many different comprehensive and inclusive resources available for families, whatever your needs may be. For visual learners, try looking over anatomical charts and photos, or safely pointing out body parts during bath time. Look for resources that fully and accurately describe sexual parts. For example, a child with female sexual parts should get resources that clearly differentiate between often confused parts like the vagina and the vulva, or the clitoris and urethra. There are many great educational videos available on YouTube and family resource sites for those who learn by listening. Other tools such as fill-in charts, puzzles, and dolls can be effective for linguistic and hands-on learners. Accurate anatomy and access to vocabulary is important for kids who use assistive communication devices too. Don't forget to add those body parts if they don't come preloaded. As your child's first teacher, you have the power to instill positive messaging and remind your child that everybody and every body is unique, and that's okay. Everybody is different, and that's why learning about our own is so important. Beyond fostering self-understanding and competence, accurate body awareness is vital for expressing our needs and experiences. Whether it's an itch at the doctor's office or an unsafe touch, kids need the right words to speak up for their needs and be heard. This sort of basic self-advocacy sets them up for a lifetime of safer, healthier, and more fulfilling experiences. Starting the talk can be intimidating, but you can do it. You don't have to be an expert or know all the answers. It's okay to say, "That's a great question, let me find out for you," or to look at a trusted professional for the answer instead. Don't be afraid to initiate conversations and find teachable moments throughout your child's day to bring up these important topics. Remember that all youth with disabilities deserve age-appropriate information about themselves and their bodies. Many of us learn by watching, so be the model for your child when it comes to healthy touch and boundaries. Finally, just remember what it's like to be a kid. All of us had our embarrassing moments, questions, and misconceptions. So now's the opportunity to be the teacher you needed and ensure your child is getting accurate and positive information about their body and experiences. Thanks for watching, and look out for more sexuality education shorts at www.advocacydenver.org.